Good morning and welcome to Stanford Medicine's second vaccine information session. My name is Megan Mahoney, and I am the Chief of Staff for Stanford Healthcare and will be moderating today's Q&A. We will dedicate the majority of today's agenda to answering your questions about the COVID-19 vaccination process at Stanford Medicine and what to expect over the next few weeks. Thank you very much for everyone who has submitted questions to our panel. We have received over 200. We will open with remarks from the Dean of the School of Medicine, Dean Lloyd Minor, the CEO of Stanford Healthcare, David Entwistle, and the CEO of Stanford Children's Health, Paul King. Neeraj Sehgal, Stanford Healthcare Chief Medical Officer, will also provide an overview of Stanford Medicine's revised COVID-19 vaccine allocation plan. And then we'll spend the majority of our time posing the questions you've submitted to our panel of Stanford Medicine leaders who have been implementing the organization's vaccine strategy. In addition to our Stanford Healthcare CMO, Neeraj Sehgal, we are fortunate to have Denny Lund, Chief Medical Officer of Stanford Children's Hospital, Dale Beatty, Chief Nursing Officer of Stanford Healthcare, Bonnie Maldonado, who needs no introduction. She's the Senior Associate Dean of Faculty Development and Diversity and the Talby Professor of Global Health and Infectious Diseases. Larry Katz-Nelson, Associate Dean of Graduate Medical Education. Allison Kerr, Chief Administrative Officer of Clinical Operations, Helen Wilmot, Vice President of Facilities, Services and Planning, and Luann Smedley, the Executive Director and Associate Chief Nursing Officer at Children's Health. We received over 200 questions, so any question we're not able to answer today live will be included in the COVID-19 vaccination FAQs and distributed in the Stanford Medicine Pulse. And so now I'd like to turn the floor over to Dean Lloyd Minor.
Thank you, Megan. I believe that David Entwistle is going to start, and then I'll follow David. David, go ahead. Thank you.
Thanks, Lloyd. Yeah, I appreciate being able to join you today. Let me first of all share an incredible thank you and shout out. I know as we first began these series, as we were thinking about COVID and what could we do to be more communicative and transparent, I want to let you know that we actually hit the highest census of COVID patients inpatient yesterday in the main campus at 96. And I just want to thank our teams for the incredible work that you're doing on a day-to-day basis. I know as we think about this time of year and wanting to certainly celebrate with family, I appreciate that you're here making sure that our patients are cared for and are getting the care that they need. I will share that I was also excited last week. I got a text on Thursday morning that in fact the vaccine had arrived a day earlier than what we anticipated. And we anxiously awaited that for what it meant for our staff and the ability to be able to get them vaccinated. And so I will share that as we think about the vaccine rollout, we felt like this is a good news story. We're excited about this and what it meant. And I know based on the way that this is rolled out and how we have been transparent in the information that it's not necessarily perceived sometimes, that has gone as well as we thought. And I just want to let you know that we are excited that it is here and we're excited to be able to have this for you as our caregivers. Now I say why we didn't get the process exactly the way it should be and was not as transparent as it could be. I will also share though that our teams are working around the clock, literally, a cross-section of team members from throughout Stanford Medicine to make sure that we revise the vaccine rollout plan in a way that identifies the flaws that were created, but also make sure that we're doing this in a way that protects our frontline caregivers. And I can share that across Stanford Medicine, that our caregivers are the critical aspect of what we can do to provide the care. And whether you're our housekeeping team, whether you're our nursing team, our physicians, whether that's a faculty or resident physician, whether that's food service, respiratory therapy, I could go on probably forever. But I just want to let you know how critical you are. And that is the critical part. And of those that we're seeing vaccinated, that is the team that's getting the vaccines right now. I'm very optimistic, not only with the 3,900 doses that we got yesterday or on Thursday, but also the roughly 4,300 doses that we received yesterday. I'm optimistic that by the end of this calendar year, so we're literally over the next 8 or 9 days, we will have all of our frontline facing caregivers vaccinated. And that's what is most critical, is to make sure that those that are in front lines treating our patients get the vaccine first. I can tell you that Paul, Lloyd, and I are still waiting for our vaccine. Now, that's not a reluctance to get the vaccine, but as we spoke early on, that it was important for the staff to receive that are treating our patients, and that we would get it at the appropriate time. And I just want to give a huge thank you and shout out to all of those that are caring for patients now, and all of those of you who have been patient with us through this transition process with the vaccine. With that, let me turn some time over to Dean Lloyd.
Well, thank you. Thank you very much, David. And thank you everyone for joining us today and for giving us your feedback and for being with us as we revised the distribution plan and now move forward with the execution of that plan. As David indicated, we are absolutely committed to making sure that all stakeholders are heard and represented and reflected in the execution of the revised distribution plan. We put together a vaccine governance committee to ensure that the voices of all constituent stakeholder groups are represented and heard as this plan for execution and the delivery of the vaccine moves forward. As David indicated, we're excited and pleased that we've gotten the doses of the vaccine that we've gotten so far. You'll be hearing more about our anticipated additional doses, but that remains very fluid. And we're absolutely committed to transparency in giving you the updates on the status of the shipment of additional doses of vaccine and also on the status of our process of vaccinating our frontline healthcare workers. Finally, as David said, Paul and I will be waiting until all people who are eligible to receive the vaccine in that high priority group that David and others on this call today are going to describe. We're committed to waiting until all of those individuals who wish to receive the vaccine have had an opportunity to receive it prior to us receiving the vaccine. Thank you again for everything you do in delivering healthcare, in making sure that we have a safe and patient-friendly and focused environment that we all know we want to have. And thank you for your patience as we move forward together to execute on this revised plan. It's now my pleasure to turn the program over to Paul King, the President and CEO of Lucile Packard Children's Hospital and Stanford Children's Health. Paul?
Thank you, Lloyd. We started these town hall sessions, as most of you know, back in March. Much has happened since then. The thing that sustained us is that we've stuck together and we've supported each other. And we've held out hope that we'd get through this. The vaccine is evidence that the beginning of the end is finally here. We know many of you are tired, scared, frustrated, angry. We saw evidence of that from some of you last week. As David said, we celebrate this moment in history, and we know that it would not have happened without each and every one of you. We want to thank all of you for helping all of us get to this point. We want to maintain our culture where each of you is encouraged and supported to call out things that concern you. We also are reminded that our culture is one of mutual respect, where we hold each other accountable in a fashion that maintains our culture of professionalism. We simply ask that we all give each other grace and assume good intentions. You've given your all this year. We'll keep doing the same for you to ensure your health and safety. Thank you for joining us this morning. Megan.
Thank you, David, Lloyd, and Paul. Now, Neeraj Sehgal will discuss the revised COVID-19 vaccine allocation and share the Stanford Medicine COVID-19 vaccine distribution dashboard. Neeraj?
Thanks, Megan. I will also first just acknowledge that I know it's been a difficult set of days for our broader community. And so before showing the dashboard, and I know we'll have an opportunity in the Q&A to answer a number of questions about the allocation system, I just wanted to share, if folks that have not yet been vaccinated, if you've had the opportunity to walk by the 300P atrium, it's really a remarkable place of joy. I found myself there for 10 minutes looking over the overhang the last couple of days. And when you see the volunteers having the privilege, as they describe, to be able to vaccinate, watching our healthcare workers and others get vaccinated and seeing them take selfies and tears of joy, it's been hard not to be emotional, actually kind of watching that process happen, because for me, part of what it reflects is hope. That this is less than a year ago that all of us have had to make incredible sacrifices. We've been through this for 9 months. It's the holidays. I know my parents have not seen their granddaughter in over 9 months. And for many of you, I know that is a big part of why we were so enthusiastic about the opportunity to start doing the vaccination. So I just want people to hopefully find that joy, because what we're going through now is hope. It's hope that 2021 is going to look markedly different than what all of you have endured over the last 9 months. So if I can ask for the dashboard to be projected, I hope folks have had an opportunity. This is now kind of the third day that we are trying to provide a different communication vehicle to just share, I say, current state. And so I may just take a moment to walk you through the information here so that you are more comfortable understanding and interpreting what it means. We will continue to evolve the dashboard as we go forward in subsequent days. You see in the top left the number of our kind of Stanford Medicine community that we have a desire to vaccinate over the next couple months. On the bottom left reflects essentially the current state of what we'll call the 3 waves of how we are approaching those who are getting vaccinated. So we are currently in that first wave, and you see the definition there of who is captured in that category, and then the second wave that follows. Currently, we have done almost 4,000 vaccinations. So there are about 600 that have been done at Valley Care and about 3,400 to 3,500 here in the 300P atrium. If you look at the middle bars, you notice that the ramping up is pretty remarkable. We did almost 1,600 vaccines alone yesterday in the 300P atrium. We made a big decision on Sunday, and so I want to be clear about the decision we made on Sunday, which is, if you've been following the news and around the country from other academic medical centers, this window has given me a very quick network into about 15 or 16 of my colleagues in other places. Everyone is struggling with the rollout in different ways. There are a number of organizations, because of similar process steps, in fact, pause their vaccination program and stop vaccinating for a day or two to kind of re-change their approach. We made the decision on Sunday to say, can we do both? We had more supply of vaccine than we anticipated. A couple of weeks ago, we were planning for the possibility of having 1,000 doses and maybe only to be able to provide it to 500 people, knowing that they needed 2 doses. We were in a markedly different place when we recognized our vaccine supply was much greater. And the decision we made on Sunday collectively was to say, we have vaccine, let's use it as fast as we can, still grounded in the same principles we set out from the beginning, which was trying to be equitable, try to prevent and protect our essential healthcare workforce, and we're moving closely towards that. We recognize the last few days have made the process a little bit more choppy than we would like, and we're moving quickly to what we hope will be a more standard process that all of you will experience, which is you will get an invitation through MyHealth to schedule your vaccine. A large number of those have already been sent out over the last several days. A lot more got sent out last night and this morning, and virtually everyone in that first wave through December 28th will have a MyHealth invitation, we hope, waiting for you here in the next 24 hours. In addition, for those of you that are in that second wave, we also still are looking to meet our goal of having everyone vaccinated by the end of next week, as David alluded to. And those MyHealth invitations also we are hoping to get out at the end of this week. If I finish this set of comments initially just at the right side of the dashboard, I think it's a really important one, as a number of folks have alluded to, which is our vaccine supply. If you reflect back early in the pandemic, we focused a lot on PPE and the shortage of PPE. For better or worse, we had control over that supply chain, worked really hard to try to get as much PPE as possible. The vaccine supply is a little bit different. We don't have control over it. The allocations come from the state and the county. And so believe me, we are on the phone almost every day trying to understand when it's coming And there's excitement when the text messages come that the vaccine has arrived. And so what you see on the right, and this is new information as of yesterday, so we had the initial 3,900 doses of Pfizer. And the reason you see that number be more than 3,900 is because those doses were 5 doses in a vial. And what we learned literally last Thursday and Friday is that there was extra vaccine in there. And so there was a lot of discussion at the CDC and FDA about how to manage that extra dose. And so fortunately, we've been able to use those 6 doses in many of those vials. It's allowed us to take those numbers initially 4,000 and make them higher as a result of the extra doses. So as of this moment, we've received 2 allotments from Pfizer, the second that came yesterday. So we have almost 8,000 doses of vaccine, which will cover essentially the entire wave 1. So we are doing that as fast as we can. And we are waiting for our final first allotment of the Moderna vaccine. And we are hoping we will get news about that in the next 24 to 48 hours, with the intent that if that does arrive as we hope before the 28th, we will similarly get through the second wave as fast as we possibly can. So we will continue to update this dashboard. We recognize a lot of questions have come about who are actually vaccinating. And because the process has been a little bit less automated the last few days, we were just trying to play catch up on the data in terms of who is getting vaccinated. But I want to assure everyone that the same principles of health equity that we tried to put into the process at the beginning are the same way we have tried to allocate who's getting the vaccine across different members of the healthcare workforce over the last several days. And as soon as we have the ability to share that data, we will make that more visible to all of you in the dashboard and other places. So thank you, and I will look forward to the Q&A that follows. Megan, I'll turn it back to you.
Yeah, thanks, Neeraj. This is all great news. It's great to see the level of transparency in the dashboard. So now we'll start the panel discussion. Thank you all for participating. The first question goes to you, Neeraj. What went wrong with the original approach used to determine vaccine allocation?
Yeah, Megan, needless to say, the number one question, not just here within our own organization, obviously a lot of attention nationally around it. I might start by just sharing, I alluded to that I've now had an opportunity to interact with probably 15 or 16 other chief medical officers at other academic medical centers. And the way I might frame this is to say that, so there were some mistakes made in the execution, and I will touch on that. But just to talk about the model, I think there's been a lot of discussion about the algorithm. Almost every hospital, every health center has a model with virtually the same variables. There are some variables that are focused on age, with some weighting of those variables. Over 65 has been one that everyone has seen, partly reflecting who tends to get severe illness and is dying from COVID. There's also variables that weight who in the community are more likely to be getting COVID, and then perhaps bringing them into the healthcare setting. And so that is a lot of the health inequities we've seen about who's been impacted in different ways because of COVID are a lot of our communities of color, a lot of our communities who tend to be our essential workers, food service workers, and others that we think were a really important part of our initial model to help achieve our health equity goals. There also are variables that included where you worked and in which location. And so what I want people to recognize is those models are almost identical at every place. The differences were how the different variables were weighted. And so I'll give you a couple extremes. There are some places that made their model and what their allocation purely based on the community model where transmission was happening, which means that many of the providers who are actually taking care of patients with COVID were in fact put lower in their sequencing. On the other end of the spectrum, there are those that were put in waves and then just entirely randomized and said, we're not going to try to make those decisions. We're just going to randomize everyone into buckets. I share it just to point out that this is just a difficult process. And so I hope everyone recognizes there's no intent to be exclusive of anyone. The intent was, in fact, to be equitable and be inclusive, and why we tried to focus a lot on sequencing rather than the notion of whether you get the vaccine today or tomorrow is less important, then we're going to try to get the vaccine to everyone. So I think where our model, and I think what people experienced last week, and the actual mistake in some ways that was made, was that when the initial lists, as everyone has heard about, were getting generated, the idea was for those lists to be reviewed to basically get face validity, like, does this actually make sense? We had certainly some data issues. And then as David alluded to in his introductory remarks, our entire team was planning for the vaccinations to start on Saturday. And when the vaccines arrived early, we rapidly shifted the timeline up 24 hours because we, of course, were so excited to get the vaccine started and didn't want it sitting around. The reality is, as most people know, wearing your patient safety hat, that when a mistake like this happens, it's never a single person, a single team, or a single process. It is a number of missteps that all kind of lined up to perfectly create the mistake that in this case was lists prematurely being put out as if they were truth when they were really supposed to be reviewed. And we own that. We made that mistake. And that's partly why when we learned about it, or I learned about it Thursday morning, we tried to pull the group of leaders together, and we very quickly pivoted and said, listen, we have this huge opportunity. We have enough supply of vaccine. Let's try to get the right people vaccinated as fast as we can. And the process will be choppy, but we will get there through the course of the week. So again, I appreciate the compassion and patience as folks are learning from their colleagues in other places. Everyone is trying to do this as well as we can, and we certainly own that we could have done certain steps better, but we hope people continue to be hopeful and joyful for what we are going to be able to provide over the next couple of weeks.
Great, thanks, Neeraj. The next question is for Dale. How is Stanford Medicine ensuring that its vaccine governance committee is more representative of our community in decision-making?
Thank you, Megan. A real specific focus has been placed on standing up our vaccination governance structure for all of Stanford Medicine, which is co-chaired by Dr. Isla Skinner, who is the chair of urology, and myself, and really is made up of representatives across all entities in our Stanford community. So we're really excited about that. Our goal is obviously to advise on longer-term vaccination strategies, as Neeraj mentioned earlier, really focusing on equitability and distribution across Stanford Medicine, Stanford University, our patients, and truly our broader community. And really one of our areas of focus is to ensure that we have internal and external stakeholders engaged in the entire process, as well as a strong communication plan. So we have launched the Stanford Vaccination Governance and are moving forward.
Great, fantastic, Dale. Thank you so much. This next question is for Denny. How is pediatrics being incorporated into the vaccination plans? A lot of us are feeling forgotten during this process.
Once a day, I'm going to do that. Forget to unmute myself. Thanks, Megan. So even though our hospitals are separate, licensed hospitals, we've been functionally joined at the hip through this entire process. Neeraj and I are on continuous speed dial, as are all of our leaders, Luann and Dale, and our COOs, making sure that the processes that are being developed by our HRT group are being applied equitably across both organizations. I also want to say that, we really are remarkably fortunate. I want to reemphasize what Neeraj has said, that we have access to so much vaccine so early in the process. And it is our goal to vaccinate everybody as fast, who wants to be vaccinated, as fast as we can get it done. We've been in touch with other academic medical centers, other children's hospitals, and they don't have the access to the vaccine that we have. So we're remarkably fortunate in that regard. And I also want to reiterate what Neeraj said, that this really is a celebration. We're one community, pediatrics and adult health caregivers, and we're going to get everybody vaccinated as quickly as we can.
Fantastic, thank you. The next question is for Neeraj. How many healthcare workers are being vaccinated every day, and how will receiving the Moderna vaccine impact our daily allocations?
Yeah, thanks, Megan. I might reinforce a few pieces, recognizing the visuals now no longer in front of folks, but if you have that dashboard. So when we started on Friday, as we ramped up, we started by doing 600 vaccines a day. Yesterday, we hit almost 1,600, at least in the 300 PH room. As I mentioned, Valley Care is having their process as well. And that was vaccinating between 7 a.m. and 11 p.m. The team has literally, as David said, worked around the clock to increase the capacity. The goal a week ago was trying to see if we could ramp up to 1,000 vaccines a day. Being at 1,600 a day yesterday, we are on track to hit about 1,600 today based on the rapid scheduling that's happening. And so, as I mentioned, that will allow us to essentially, that entire first wave of about 8,000 healthcare workers should be vaccinated by the end of this first stretch up to December 28th. If in fact we receive the Moderna vaccine that we are hoping and expecting, unlike the Pfizer vaccine that gets allocated from the county but is directly sent to us, the Moderna vaccine will actually go to the county, and we have a team, I kid you not, with a truck that is ready to drive over to the county and pick it up the second we get the phone call to bring it back here. And so if in fact we do get the 12 to 13,000 doses of Moderna vaccine as we anticipate, we will be able to rapidly accelerate the process. The last piece I will also mention, back to my reflections on the 300P atrium, is we've talked a lot during the COVID elements of the be safe, be smart, be kind. And I think the other piece to continue to remember is the be kind and be kinder. Down in the vaccine area, it's been great to see people actually come together. I know there's a lot of angst and stress in terms of what was happening process-wise, but we want to keep people really positive. And so I hope people continue to see the joy and hope that will come with the vaccines.
Oh, that is so inspiring to hear. That's great. The next question is for Luann. Can you comment on, are there the magnitude of employees who are opting out of the vaccine when offered one? And also, how are you factoring this into long-term occupational health plans to keep all of our workers and patients safe?
I did it too, Denny. Thank you, Megan. Of the 30,000 employees that have indicated their decision to take the vaccine in the HealthStream module, about 95 are actually accepting the vaccine, which is such great news. We do have some people choosing to defer. And of those people that want to defer to a later time, we will actually manage that at an operational level at the unit level. Only about, of course, 5% of employees are declining the vaccine. So we remain really hopeful that this trend will continue.
Thank you so much. The next question is for Bonnie. Besides Moderna and Pfizer, are there other vaccine candidates close to receiving emergency use authorization from the FDA?
Yes, thank you, Megan. Absolutely. We, as you know, we have really rolled out not only the Pfizer, but the Moderna vaccine. And one of the things I want to mention around equity is that the Pfizer vaccine is a little more limited. We were actually very lucky to get it. It went to less than 1,000 places around the country, whereas the Moderna is going to more than a couple thousand places around the country because it's easier to store. And so it reaches places that otherwise the Pfizer couldn't reach. But we are also seeing two other vaccines that should be close pretty soon. Early in 2021, we think Johnson & Johnson is working with a company named Janssen, who has put together an adenovirus vectored vaccine. They completed their enrollment last week in their vaccine trials. And actually, Stanford was one of the sites. They've enrolled 40,000 people in their trials around the world, and they're quickly analyzing their data now. The early indications, they did publish a paper in the New England Journal of Medicine earlier this month, and it looks like this vaccine is going to be just as safe and effective, but of course we don't have all the data yet. So we anticipate that Johnson & Johnson vaccine, which is a one-dose vaccine and doesn't need to be stored in any refrigeration at all because it's not an mRNA vaccine, will be reviewed by the FDA probably late January or early February. So we may have a third vaccine available in March. And then there's a fourth vaccine, the AstraZeneca Oxford vaccine, which is also an adenovirus vectored vaccine like the Janssen. And that vaccine trial, those trials are continuing in the US. It will be looking at approval. So if you hear about it, they'll be looking for approval outside the US. Because of the way the data was presented, the FDA did not accept the current data so far. So they're asking for additional studies. We anticipate that vaccine should be reviewed by the FDA sometime in either the summer or fall of 2021. But with the other three vaccines ready to go, we think that we'll have plenty of vaccine over the coming spring and fall for the general population as well.
Wow, that's great news. Thank you, Bonnie. The next question is for Allie. These vaccines have side effects that, although generally mild, could cause some of our healthcare workers to call in sick. How are you accounting for that in the rollout plan to avoid disrupting normal operations?
Thank you, Megan. So yeah, it's true. Like all vaccines, there is a chance for side effects. And these side effects are generally mild and limited. though on occasion impact others. And I think we have learned through the data is that the side effects can be general, from muscle aches to headaches, or sort of soreness at the injection site. And those typically will happen the day after. It doesn't impact everybody, of course. In terms of strategies to compensate for this, the managers on the units are looking to send sort of smaller groups down at a time. And they're also encouraging, as people look to schedule their appointments, if they want to schedule their appointments for their vaccination before a day off, they're welcome to do so, such that we maintain our workforce. So thank you for your question, Megan.
Thanks, Sally. The next one's for Neeraj. For Stanford Medicine employees that aren't patient-facing, how are you determining who gets priority access in 2021?
Yeah, thanks, Megan. I'll say that kind of real-time reflection that if we go back even a few weeks ago, as a group, we had been trying to organize with the vaccine infrastructure, 5 or 6 different kind of waves. Again, because of our vaccine supply, we've been able to really collapse that into essentially 3, which is the ones you've seen on the dashboard. We've also tried to emphasize less on the prioritization, provided we have the right people in each of those waves. This just becomes a function of sequencing. And the sequencing is within that period, everyone is going to get vaccinated. I recognize it's easy to say that and then recognize what we've experienced the last several days, which is everyone wants the hope and the joy of sitting in that seat and getting vaccinated as fast as possible. And so I think it goes back to 2 pieces. So one is making sure we have the right people and making sure people have been identified appropriately. And so we're working with a lot of clinical chairs, a lot of the vice presidents and other operational leaders to make sure we're not missing people or people are not in the right area. So that's number 1, that we're really trying to do our best to or better communicate that. And then number 2, I'll put it back to the operational team that's been amazing, which is they're going to be doing between 7 a.m. and 11 p.m. on Christmas Day, on New Year's Eve, on New Year's Day. And so again, the goal is as we identify folks and their sequence, we want to try to vaccinate people as quickly as possible. And so we want to keep conveying that message because we really do hope people see that getting the vaccine today versus 3 days from now, we don't want you to feel like there's a value judgment or a statement on that 2 or 3 day difference, that we really want to focus on getting everyone vaccinated. So we're a safer community and we're going to be that. By the end of this calendar year, when we hit 2021, we're going to be a much safer community. And that will continue as we hit the rest of our community that are less patient facing in the early part of January.
Excellent news. Thank you, Neeraj. The next question is for Helen. What are we doing to keep frontline staff informed and engaged throughout this process?
Thanks, Megan. That's a complicated question. We're a large organization of 30,000 people, and in this day and age in which information moves very quickly, and in an environment like this where there's emotion attached to it and also to fact-based, it's difficult to figure out as to what are the forums and what's the appropriate way to do that. We have a very effective communications program in regards to the enterprise-wide. The objective of that program is to make sure, first of all, that we have the right facts in front of us, that they have information from all of the different areas, and then that we also provide tools to each of the management so they actually can roll it out to their environment and in their huddles. People absorb information differently and want different information. And so there is a wide array of different types of information that is available. It has the same messaging, but how we communicate it can be very different between our different environments. And so we ask that the management team utilize those tools as they roll it out to each of their departments. There's obviously corporate communications that we do, but also too, the most powerful and impactful is the ones in which we are able to give it to the managers that they can get it out to their huddles. Thank you.
Great, thank you, Helen. So this next question is for Bonnie. There's a new variant of the coronavirus taking hold in the UK. What do we know about it? And are current vaccines effective against it?
Well, yes, there's new data. And as you know, we're going to be tracking all of the different viral strains that come out around the world. That has been happening since early in 2020. So we have maps looking at viral mutations over time. These viruses are going to mutate, and RNA viruses in particular mutate pretty rapidly. But the question is, are they going to mutate in meaningful ways? And what we understand from this particular mutant is not very much, except to say that there are a handful of mutations in this virus, a few of which occur in the spike protein, which is where the immunity needs to be in order to prevent infection or perhaps infection, but for sure disease. There is no indication at this time that those mutants are going to make a difference at this point in the way the vaccine works. The companies, Moderna and Pfizer, are actively seeking those strains and working with them now in their labs to see if antibodies from people who've been vaccinated can actually neutralize them. And they have already done studies with other strains from people who were vaccinated and got disease. So the few people who did get infected or get disease after vaccination, and those, they demonstrated the antibodies in the laboratory did work. So no vaccine is 100% perfect. And so we will see a few breakthrough people and get disease. And we do think that this mutation these will continue to occur. They are easy to track. And we will be able to measure them in the laboratory. What they mean clinically is not clear, but if in any event, if there is a problem where, let's just say over a series of weeks to months or even longer, the viruses manage to develop enough mutations to escape the vaccine, which is unlikely to happen at this time. The vaccine itself has a very easy way of being recalibrated to address those questions. So I think everybody's really anticipating any potential problems down the line, but we don't think that that will be a concern at this point, or even in weeks and weeks to come, or even months to come.
Okay, so thank you, Bonnie. Helen, this is the next question for you. Are you accepting eligible personnel to get vaccinated, even if they do not have an appointment?
A good question. And Neeraj has addressed some of what I'll actually talk about, but let me just do it in full summary so we can understand what the logistics are down at 300P Atrium. If you have not been down there, although we don't want you down there too much because we want to make sure we keep social distancing, look over the atrium railing, folks. It will be very encouraging. Literally, I think almost everyone takes a selfie. They're so excited to do it. So getting down to facts now, there's 4 components that we are trying to manage when we manage the logistics of this. One is the dosing. The second is ensuring that we are getting to our frontline staff, whether you want to call that wave 1, whatever it is. The third is equity. Want to make sure we get the equity across the institution. And then the last is managing the logistics and essentially just the logistics of the line and actually how we can do that. The dosing, Neeraj talked about, and several, and Bonnie and others have talked about, and Ali, about the fact that looks like we're getting more dosing. So the plan has modified, and that's what you'll see. There are emails that go out during the day. The front line and the equity, Neeraj also addressed that as well in regards to the adjustment to that. And then just managing the logistics on the line. So what we do is we have readjusted in the My Health, the appointment program comes out. And then as we actually see the day, we see the end of the day before, and then we see the appointments for the day, is what we do is if all the appointments have not filled up, or if we think we have more capacity, is we are in fact releasing an allotment of an unscheduled or now to be scheduled add-on. And so that's the way that we're managing it, because we want to make sure we maximize. Yesterday we did 1,600. I don't know, maybe today our logistics get even smoother. We can do 1,700. If the dosing allows us, we'll expand as fast as we can to get as many vaccinations done. So you will see, and people actually think it's a walk-in. It's not a walk-in. It's a scheduled add-on as we do the allotments beyond the ones that are appointments. And so we're very pleased to be able to do it, but I know that sometimes it can actually be misinterpreted, but we're totally pleased to do that. Thank you.
That's great. Thank you, Helen. Next question is for Larry. It says, I'm concerned that our vaccine distribution plans are being unfairly influenced by loud groups and individuals jockeying for a better position on the distribution list. I'm seeing this create competition and anger. Can you please comment on this?
Yes, Megan, thank you for your question. As many of you have experienced or saw in the media, there were a lot of raw emotions on Friday, including requests by residents and fellows for transparency in what transpired, more resident involvement in hospital committees and decision-making areas, as well as desire to ensure vaccine for the frontline providers. To address this, we opened up walk-ins that day, and with the help of unit and department leaders at both Stanford and Packard hospitals, scheduled vaccines for residents working in the high-risk areas, including critical care and the inpatient COVID units. I and other department leaders have delayed receiving the vaccine until the residents have received theirs. We have shared that there were clear flaws in how the plan was rolled out, and these have been addressed, as you heard earlier from Neeraj. We agree that we need to be thoughtful for the rollout for all hospital groups, that we really are one community, and I have been very impressed how everyone has worked together to ensure that all members of the community are supported and vaccinated.
Thank you, Larry. Next question is for Bonnie. How is the Moderna vaccine different from Pfizer's? Are there any significant differences between the two?
Well, first of all, I'd like to say that these two vaccines are absolutely stunning in the way they both are safe and effective. The platforms are brand new, and that has been worrisome to some, and certainly to me when we first heard about them, but these are amazing, safe and effective in most populations, and will be studied in subsets of populations that weren't addressed in the original studies. But having said that, there are a few differences that have nothing to do with safety or efficacy, and that has to do with the fact, obviously, that Pfizer vaccine is it needs to be stored at ultra cold temperatures, whereas the Moderna vaccine requires regular freezer temperatures. That, in fact, will help us bolster vaccine distribution because we can give the Pfizer vaccine to the facilities that can have that capacity to freeze at -70, and Moderna can go out to more rural areas and areas with less access. And that was a really exciting point. The other differences really have to do with the fact that the dosing is different. So the Pfizer vaccine is given every 3 weeks apart, and the Moderna is given every 4 weeks apart. Other than that, there really aren't any major differences in the two vaccines. And we hope that they will be taken up equally well and no preference is given to either one. Thank you so much.
Great, thank you, Bonnie. Next question is for Allie. Can you talk more about Stanford Medicine's vaccine supply? After our initial shipments from Pfizer and Moderna, will there be any additional or regular shipments coming in?
Great. Thank you, Megan. And Neeraj talked a lot about the vaccines that we have in the organization, and I too feel very grateful for the amount that we've been able to receive. So I just want to give assurances to folks that our management of the vaccine has been done in accordance with both the CDC and our CDPH guidelines that have been given to us. The shipments are sent through what we call an allocation process, and the Pfizer is sending to Stanford directly, while the Moderna vaccine will be sent through Santa Clara County, which is our county where obviously our hospital is. As you know, we've received 2 doses of Pfizer. And then we expect to receive Moderna, I'll just say any day. And so we're all waiting on pins and needles. Deepak texts me as soon as he will hear from the county, and he will be going down in his truck to pick it up and bringing it back to all of us to help fill up that hope and joy. I won't go through the numbers of the vaccines, but essentially all of the vaccines that we're receiving, both the 2 from Pfizer and the 1 from Moderna, will be all for the first vaccines that people will receive. We are scheduled to receive second doses, which, as we all know, both of those vaccines, you need 2 doses for it to be fully complete. And we will get additional allocations from both Pfizer and Moderna. So all of the vaccines that we'll have in the next few days will be for the first vaccines. And we'll continue to receive more in the future to continue to vaccine our community. Thank you, Megan.
Well, great. Thank you. I think we are at time, so we'll close our session today. And I just want to thank all of our panelists for their time and incredible leadership during this unprecedented time. Most of all, I want to thank you all for joining us today and for all that you do every day. Just as a reminder, any questions that we were not able to answer today will be included in the vaccination FAQs and distributed in the Stanford Medicine Pulse. And there'll be additional sessions to come. I wish you all a safe and joyful holiday season.